Hello, everyone. My name is Katie Parsons, and I'm Associate Director of Content, Education, and Business Services here at SmartBrief. I'm joined today by Dr. Arif Kamal, Chief Patient Officer at the American Cancer Society, and Dr. Carlos Doty, Vice President and Head of Medical Affairs, U.S. Oncology at AstraZeneca. It's great to have both of you here to lend your expertise on the topic of patient navigation and how, when done correctly, it can improve patient care. So Dr. Kamal, what I want to know is, first of all, what is patient navigation? How does it improve cancer care? And what does it mean to the American Cancer Society?
Yeah, thanks, Katie, for having me. And, I think to start with what is navigation really has to start with the why of navigation. And it's because healthcare is complex. I mean, that's the place to start. For any of us who were to, unfortunately, let's say, experience a cancer journey that started today with a telephone call, would mean a lot of emotion and a lot of logistical lack of clarity. For many people who don't work at a medical center, and I do as an oncologist, even for myself, trying to understand what is step 1, 2, 3 through probably step 200 to actually get through that cancer journey is hard for us to imagine, let alone sort of tie together. So the concept of navigation is to have a trusted peer, oftentimes a paid clinician, a social worker, a nurse, and even community volunteer workers in some form or fashion, standing together, shoulder to shoulder, elbow to elbow, to identify what are the next steps, what are the common barriers, and how do we break through those barriers to make sure that everyone has access to not only the best standard of care, but also clinical trials and all the supportive care services that are going to be needed to get someone through a diagnosis.
AstraZeneca recently committed $2.8 million to ACS's Navigation Capacity Building Initiative, which is focused on advancing high-quality cancer care through capacity building and support for sustainable models of oncology patient navigation. So clearly, that's a body of work that aligns with AstraZeneca's corporate values. What specifically about patient navigation do you feel is most important in cancer care?
As Dr. Kamal mentioned, the complexity of the healthcare system today, it's overwhelming. And you are facing this the first time as an oncology patient or a family that has been affected by cancer for the first time in also a very complex time. The good news is that there's so many different options today for patients that treatment is not a straight line. But you need help to navigate the system, the options, and including, as Dr. Kamal mentioned, not only the available options from your health system, but clinical trials.
Dr. Kamal, can you tell us a little more about the program of work ACS has prioritized to support navigation for patients, everything from the capacity work funded by AstraZeneca to ACS Cares?
Yeah, Katie. So from the American Cancer Society, we're very committed to navigation because we see this as an important lever to get people to where they need to go. And as Dr. Doty mentioned, which I like that analogy very much, this idea that the experience matters is really important. I think oncology 20, 30 years ago was about, do we have a cure? Do we have a treatment? Do we have a place for someone to go? It was really a question of, does something exist? And today, the compelling question of 2023 is not, does something exist? It's whether people have access to it. And what we recognize is that the disparities in outcomes largely have everything to do with access, and navigation is an important way of addressing that. And the American Cancer Society, we're very committed, for example, to the cancer moonshot goal of reducing overall cancer mortality by 50% over the next 25 years, with like AstraZeneca, who's very interested in developing the innovations to get people to cure. We're very happy to work in concert together to make sure people get access to those cures as well. So we do that in a couple different ways. One is our capacity building navigation grant initiative as funded by AstraZeneca and other partners. The idea is to find programs in navigation across the country that are in existence at health systems and really add jet fuel to their programs so to be able to build it out further and to create a learning community so that we can learn about all the evidence needed to really convince policymakers that this is not only standard of care, but best-in-class practice, and that there should be a roadmap for reimbursement. Because fundamentally, that's the issue, is ACS and AstraZeneca will continue to have to fund these programs until we find sustainable ways that payers are doing that. The second way that we're engaged in navigation is around our ACS Cares program. That's our peer-to-peer navigation program. And what we recognize at ACS is there are literally millions of cancer survivors and friends and caregivers out there who have something to share. lines. And so ACS Care's vision is to connect people who have similar backgrounds, similar experiences to each other so that no one goes through a cancer journey alone.
Dr. Doty, how can businesses and other organizations partner or get involved?
I cannot tell other organizations what to do, but definitely we need more partners, right? And when I'm talking about partners is organizations, pharma, NGOs, so everyone together for a specific group of patients. Is how can we find ways to reach out to more patients faster with targeted therapies, with early diagnosis, with screening, and if you have that diagnosis, to get to that first treatment as fast as possible and implement the best possible treatment in the front line, and if not, in the second, and so on. This is a big call to action for all of us involved in some way or another in cancer. Let's partner together and change the possibilities of patients getting better care fast.
And Dr. Kamal, I'd be interested to hear, have you add to that as well, especially from the American Cancer Society's view of this idea that the more stakeholders involved, the more communities involved, the better. What are your thoughts?
Yeah, well, I love Dr. Doty's thoughts, and I'll add on that, we published research recently that 45% of all cancers, we believe at the American Cancer Society, are preventable through lifestyle change. Now, we've done a great job as a society and as the world of recognizing things like tobacco and its link, but we're also now increasingly understanding what lifestyle choices people make as it relates to healthy weight, healthy eating, and lifestyle activity that really contribute to cancer. So if you say that nearly half can be prevented through changing how we live, it means that navigation also has to extend into cancer prevention. And at the American Cancer Society, we're very interested in partnering with any organization across the continuum of risk, particularly, organizations that are looking at food as medicine, organizations that are looking at active lifestyles, healthy eating, healthy weight, et cetera. Because I think fundamentally to get to where we want to be, which is less cancer and less death from cancer, we have to, this is a, sort of an ounce of prevention really being more than a pound of cure. And I think fundamentally, to Dr. Doty's point too, in terms of bringing the entire system together, is we recognize in cancer that maybe 80% of outcomes in cancer are not related to tumor biology, but they're really related to people, access, their environment, the systems they live in, and so on. So for example, there was a study a handful of years ago that demonstrated that a cancer patient having an identified primary caregiver, right, who'd come to them to appointments and help them take their medications and so on, that person, regardless of stage of disease, had a longer chance of living than a person who didn't have a primary caregiver. So that's an example maybe for some of us that we may take for granted, right, of having, but we start to recognize, even in my own clinical practice, that when a patient walks in alone, I ask the question, who else is in your life that can help you? Because if they tell me there's no one else, for example, that they truly are socially isolated or don't have access to a lot of resources, being paid or unpaid or family, that I do worry about them in a different way. And I think that gestalt is actually now proving itself in the data.
And Dr. Kamal, I think we'll just end with you. If someone's listening to this and maybe they want to partner with ACS or they want to get more involved in this idea of patient navigation and cancer care access and equity, what would you suggest for them?
And so I would encourage anyone to reach out to the American Cancer Society and help us brainstorm together, because we're going to co-create solutions. I don't think that we take the idea that we're the smartest people in the room. In fact, we like to be in rooms where we're not the smartest folks, where we're hearing the voices of other people and letting those brainstorming happen, letting that light bulb sort of go off and then say, okay, let's go in that direction. And the capacity building grants are a really good example of that. We reached out to partners ahead of time, and folks like AstraZeneca and others said, oh my gosh, that's exactly where we need to make investments. Things like peer-to-peer navigation came from that as well. And the future ideas are going to become, not because ACS is the smartest people in the room, but because we've chosen to partner with other smart people too.